Hello, and thank you for joining today's webinar titled What You Need to Know About the Novel Coronavirus, COVID-19 with healthcare expert Dr. Stephen Schimpf. Due to growing concern and uncertainty about COVID-19, we at Paragon Private Health are taking a proactive approach to sharing accurate information. For Paragon Concierge members, this is the best time to use your benefits, including 24/7 after-hour and direct cell phone access to your physician. This is especially important if you're feeling symptomatic. If you're worried about COVID-19, which we're sure many of you may be, please remember that your physician is there for you. We will continue to stay on top of and send you relevant advisories via your weekly wellness newsletters from sources like CDC and WHO to keep you informed. With so much information circulating in the media about COVID-19, it can be confusing and even difficult to know what information is true, what are the best sources, and what you can do in these times of uncertainty. Therefore, today's webinar we're going to provide you with scientific overview of what COVID-19 is, how the disease is spreading, and what you can do to help improve the prevention and decrease the spread of this disease. We're also going to advise you on the best sources of information that you can turn to following today's webinar. Here to share information is Dr. Stephen Schimpf. Dr. Schimpf spent his time as the CEO of the University of Maryland Medical Center, as the former head of infectious disease, and as a professor of public policy. He's an internist, a researcher, and a professor of medicine. At this time, I would like to turn it over to Dr. Schimpf, who's joining us via satellite from Baltimore, Maryland.
Hello, everyone. I've been asked if I would give a brief update on the coronavirus situation. And I do want to point out, I am a physician, but I'm not your physician. So this is just information. To get any kind of medical advice, call your physician. That's really important. Talk to your physician. So let's begin. I've got a little picture here of a coronavirus. You see all the little spikes coming up. And those spikes are what give it its name, corona, meaning crown. It's a little far-fetched perhaps, but anyway, that's the name. And there are 7 varieties of this virus. 4 of them cause the common cold, and they're around all the time. Maybe 20–30% of common colds are caused by those 4 variants of a coronavirus. Generally, mild sorts of things. But there are 3 types, though, that have been quite severe. A decade or so ago, we had SARS. Remember that? Severe acute respiratory syndrome. And so that was a coronavirus that came out of China. And then the next one was MERS, Middle East Respiratory Syndrome. And that died out after a while. Neither of those ever got here. And now we have the coronavirus, which has now been named COVID-19. So COVID for coronavirus, ID for infection, and then 19 because it started in 2019. So it's COVID really is the name of the disease, not the virus, but we'll use those interchangeably. Excuse me. So you know that the current epidemic began in Wuhan in China, and it has spread rapidly in China. And in part it spreads rapidly because most people get either no symptoms or relatively mild symptoms. I'll come back to that in a minute. Anyway, it spread rapidly. It then got to South Korea, it got to Italy, it got to Iran. But last time I looked, it was in 55 different countries, and I'm sure by the time you see this, it'll be in many more countries. And of course, it's here now. So what kinds of infection? Well, this virus and those spikes are able to attach to the lining of our respiratory tract, the nose, the sinuses, pharyngeal area, and then down the trachea and the bronchi. And so that's why it can cause all these various symptoms of a cough, of cold, of pneumonia in this case, not usually, but it can. So most cases it's more like a cold, runny nose and cough, sometimes a bronchitis sort of thing, and then in some people the pneumonia. So I've already mentioned what kind of infections. Now how does it spread? Well, like a common cold or like influenza, it's spread by droplets. So if I cough at you, if I sneeze at you, those little droplets can carry a long, particularly a sneeze, they can carry a very long distance. And they finally settle down. But it's that droplet spread, droplet transmission, so the cough, the sneezing, but then if it gets on something, if it gets on, well, for example, in restrooms, or on the handle of the flush, on the handle of the faucet, on the handle of the door. We'll come back to those when we talk about prevention a little bit. So how dangerous is it? Well, in the vast majority of cases, it's not dangerous. But in some people, it is. And just yesterday, the CDC, Centers for Disease Control, upped the mortality rate projections from 2%, which they'd been saying, now to something like 3.4%. I think that number's too high. The reason I think it's too high is because not enough people have been tested that have very mild disease. The criteria for testing people has been those who have been pretty sick. But now that the test kits are available across all every state's public health system has them, academic medical centers have those test kits. And we're going to see more and more people tested, and I'm just assuming, don't know this for sure, but I'm assuming that when that happens, we'll see that there's the denominator, if you will, of people with the disease is going to be mild, and then up the pyramid to pneumonia and death will get less and less. So I thought this might be interesting to you, China being where it all started. There was a publication in the Journal of the American Medical Association just last week from China, from the Chinese Health Ministry, and it looks at all the cases up till mid-February that have occurred in China that they know about. Again, that's that they know about. And that turns out to be some 72,000 cases. And by their criteria, some 44,000 are what they call confirmed. And if you look at the bottom, I know it's in small print there, but at the bottom, asymptomatic cases, just 1%. But again, not enough people have been tested with, quote, the common cold. So we'll see what happens. In any event, how about the age distribution? It's interesting that most people, that bell-shaped curve, most people are in middle age. Relatively few, only 3% were over the age of 80, and only 1% were under the age of 20. So it's interesting that it's really in middle age. Why is that? Well, maybe because they're the ones that are out going shopping, going to the movies, going to work, coming back, and so on. Although younger folks are going to school, so why they don't have it, I don't know. Of those confirmed cases, they listed that 81% were pretty mild. 81%. Well, that means that the others weren't so mild, but again, do we know the full denominator? So how dangerous is it? Well, it's most dangerous in older people, even though they were getting fewer of it. They're the ones who get the sickest. Those people who have reduced immune systems, like on chemotherapy or an organ transplant, as you would suspect, if your immune system's down, it's going to be more severe. So the big question is then, and this is probably the most important thing, how can I protect myself? And I want to just say to start, if you say, I'm going to look out for myself, that's selfish. It's not selfish. It's actually, you're doing yourself a favor, of course, but you're doing everyone else a favor if you can prevent yourself from getting sick. So it's really a value to others to try and keep yourself from getting sick. So I would just say it this way. You know what to do for influenza. It's the same thing. You're trying to avoid that droplet transmission. So you want to wash your hands frequently. That's number one. Avoid people who are coughing or sneezing. That's number two. Don't touch your eyes or your face before you wash your hands. And we all tend to do that. We just do a little bit like that. But if I've just been in wherever, just opened the door, say, to the grocery store, don't put your hand on your face. So if you never, this is important. Influenza is much more common right now than this virus. And influenza is here right now. It causes a lot of disease, a lot of deaths. So if you never got the flu vaccine, it's not too late. You should still get it right now. It's simply not too late. Anyway, if you can't wash your hands, and when I say wash your hands, I mean with soap and water, and really do the job for 20 seconds. Don't just kind of do a little something, but really wash your hands. You can use those alcohol disinfectants. Just look at the label and see that it says 60% alcohol. Things that are less than that are probably not terribly effective. At home, disinfect things that you use frequently. Toilet handle, faucets. You think about the faucets now that you lift up, well, you lift it up, and now underneath there gets dirty. You wash your hands, you push it down from the top. But underneath there, you just clean that every so often. If you get the disease, what should you do? Same thing as if you get influenza. Stay home. Don't go out. Certainly don't go to crowded restaurants or the movies or any place of substantial congregation. You don't need to spread it to anybody else. And frankly, I would say, without being overly cautious, even if the disease gets into your area, don't go into crowded areas. It's just common sense. Is there an antibiotic or a vaccine? There's no antibiotic, and although, and this is very exciting, there are some companies working on some drugs that they're actually testing them already in China. We won't know for a while whether they're going to be useful or not, but that will come soon. And as far as a vaccine is concerned, there's no vaccine, but there will be a vaccine, and it will probably get here faster than any vaccine ever in history, but still, as it's developed, it's going to have to be tested, have to look for safety issues, so don't expect it in the near future. We have to work through this with what we know, and what we know is protect yourself using the methodologies I've just said. So what sort of guidelines? When should you call your doctor? And I put some things down here. If you have a fever, if you have a sore throat or cough, if you have just body aches and pains, and especially if you're short of breath, without any of these other symptoms, call your physician. Don't go to the office. Call. Why do I say that? You don't need to go and spread it to your doctor, their staff, or their patients in the other patients in the waiting room. Call, get instructions on what to do. And so my basic recommendation to you is, if you look on Facebook, there's all sorts of crazy stuff. The media hypes this thing because that's how they sell newspapers, that's how they get attention on TV, and the talk shows, they're just all over the place. And there's conspiracy theories out there and so on. Don't over-worry. Yeah, you're going to worry, but don't overly worry. Think and act to prevent influenza, because if you do that, you'll think and act to prevent this disease. The basic thing is wash your hands and do it really well, and you'll be pretty well protected. But remember the social isolation if it's in your area. Now, just some basics though. Eat a good diet. Get some exercise. Manage your stress. Stress can be a major issue about reducing your immune function and making you more susceptible to getting the disease and making it more severe. And get a good night's sleep. 7.5 hours is what everybody needs, and younger people need more than that. Of course, stay away from tobacco. Tobacco just turns off the respiratory tree so that you can't clear secretions normally. You just don't want to smoke. And I know everybody knows all these things, but I just need to repeat them. Our brains need to be challenged. We need to maintain our friendships, but you might want to do it by phone. So there are a good place to get additional information, and that's at the Centers for Disease Control website, the CDC. It's up there on the screen, but if you just remember the first three parts, www.cdc.gov, and then when you bring that up, you'll see coronavirus right there. So I hope this has been a little bit of information that's been valuable to you, and I certainly hope that none of us develop the disease, but chances are some of us will. Thank you.
Thank you so much, Dr. Schimpf. We hope today's webinar has helped answer some of your questions, eased your minds a bit, and left you with the knowledge needed to help manage COVID-19 personally. Here are some online sources that we recommend: the Centers for Disease Control and Prevention, or CDC, and the World Health Organization. We will post these links in the description below. Also, a copy of today's slides and webinar will be posted to the Paragon Private Health website and also to our social media. Please keep an eye out on your emails, as your Paragon physicians may ask us to send you some direct emails with information about COVID-19. And as needed, we will host additional webinars on this topic in the future. Again, a special thank you to Dr. Schimpf. Thank you all so much. Take care.